Now to our GMA cover story, a new study pointing to a non-surgical alternative to reducing osteoarthritis knee pain. Chief Medical Correspondent Dr. Narula joined us with the details. Good morning to you, Dr. Narula, and tell us about this study and what they found.
Well, a lot of Americans suffer with knee osteoarthritis. And so this study was a small study. It looked at about 68 patients with mild to moderate osteoarthritis of the knee. The researchers divided them into two groups. One group got a placebo treatment. The other group went for 6 weeks, once a week, to a lab where they taught them essentially how to re-walk. They angled their foot or their toe 5 to 10 degrees outward or 5 to 10 degrees inward. After 1 year, the researchers evaluated them, and they found that those who got that walking therapy actually reported a reduction in pain on par with the same amount of reduction you would see with over-the-counter medications. They also, interestingly, Michael, did MRIs and saw a decrease in the amount of cartilage degeneration, so less destruction or degeneration of the knee. Now, this, again, was a small study, definitely needs to be replicated, but it points to this concept of a personalized approach, of an approach that doesn't involve medication, that could either be done in a lab or actually they've developed sensor-embedded shoes that can give you biofeedback. So this is something we may have to look forward to in the future for more people.
Well, I know somebody's paying close attention is Whit Johnson because he's always talking about his knees popping and locking around here. So what can someone do who's living with chronic knee pain?
Yeah, well, first of all, you want to get a diagnosis, right? So you would want to see an orthopedic doctor who could really tell you, is this osteoarthritis? Is this some other form of inflammatory arthritis like rheumatoid arthritis or even Lyme disease? And then they would evaluate you to see, is this something that should be treated with medication? 10 to 35% of people take either non-steroidal anti-inflammatory drugs or Tylenol, or surgery, or physical therapy. PT or physical therapy can be a really great way to treat knee pain. In fact, there was a recent study in June that was published, over 139 studies they reviewed. They looked at 12 different types of physical therapies, and they found that actually knee braces, exercise, aerobic exercise, or mind-body behavioral exercise like yoga or Tai Chi, and hydrotherapy or water therapy were effective for reducing knee pain, as was laser treatments. What was not effective, Michael, in that study was ultrasound. But really, you know, over 10% of individuals over the age of 60 have knee osteoarthritis, more common with age, genetics, and also with being overweight or obese, you may see a knee pain, osteoarthritis. But this is exciting because it is a non-drug type of therapy.
Exactly.
The gait retraining or walking retraining. Yeah,
something you can do without taking anything to do it, except for a little effort on your part.
That's right. So hopefully Whit was paying attention.
Pay attention, Whit. All right. All right. Doc, thank you.